And taking the stage now is Professor Julius Špičák. He is Emeritus Chief of the Clinic of Hepatogastroenterology at the Institute for Clinical and Experimental Medicine in Prague. He has held numerous national and international leadership roles and serves as a member of the Czech Parliament with a focus on education, research, and healthcare. He is recognized worldwide as a leading authority in the field. So, Mr. Špičák, when you're ready.
Dobrý den, vážený pane předsedo, vážení přítomní, vážení organizátoři. Především bych chtěl velice poděkovat.
I would like to thank you very much. And I also want to thank Mr. Tomáš Pfeiffer, who invited me. It's a real honor to me, and it is extremely interesting. I like various things, but I not always understand them properly. A week ago, I had I read a lecture about alternative treatment method in gastrointestinal diseases. I am one of the founders of these methods, and most of the participants were younger than I, and I am really very busy, so I said, no, I can't tell you about everything because I do not know it all. But they told me, but you have the experience, and I think that that is true in the field of gastroenterology. I must say that although I read when I read the program, I realized that the alternative methods are much broader than you would know in Czechia. For people in Czechia, there are only two types. It's homeopathy and it's Chinese medicine. These are the only alternative methods. I talked to a Czech medical doctor when I prepared for this lecture, but he is actually practicing Chinese medicine, and it was quite interesting, and it gave me some lessons. And I also realized what the benefits can be and what is still missing. I realized that what is missing are the certified studies. So I will focus on people focus on Chinese medicine, and I will do that as well. And I will speak about its impact on the regular on the bowel diseases, intestinal diseases. There's the Crohn's disease, which is specific because it focuses, it concentrates in the area with high standard of living, like Scandinavia and others, and it increases. And in the past years, as a result of the non-biological treatment, it heavily improved. It improved its symptoms. So if you have the comparative studies, no more is valid what you could see 5 years ago. And so it is very successful. This is a meta-analysis, and it is well, the meta-analysis in itself was so interesting that I could speak for the rest of my time about this only. But I will use some of the outcomes, and you will understand how difficult it is, because it compares various methods of the Chinese medicine. It is the moxibustion, for instance, with the conventional paratreatment. It dates back to 23, and it's no longer absolutely valid. Then there are some parameters and the comparison groups, the matching groups. We can have all degrees of Crohn's disease. There are certain parameters, and I am not a specialist in intestinal diseases, inflammatory diseases, so I do not know all the parameters which are being measured. Each of us has a certain index, and there is a number of studies, and they are classified depending on the level of the evidence. And as you can see on the right, sometimes the credibility is low, and small wonder, because it is very complicated. This is a lifelong disease, so it is only the relevant result which should be retained, and it is difficult to determine which one it is. This is the graphic comparison of individual methods. What is the most relevant is the acupuncture, moxibustion, Shen, moxibustion, and so on and so forth. So we would need to see in practice what it is. The sham is a sort of fake culture or false. It's for comparison, and that is very interesting, but I didn't have the opportunity of going into it more deeply. Well, this study included 12. This analysis compared 12 studies. The results were amazingly interesting. Real acupuncture and moxibustion compared whatever is the sham. And you can see the result, the activation or activating index shows very different results. So the meta-analysis concludes that more studies would be needed. It is difficult, but obviously it is based on a certain tradition, on a certain ethnical environment, and it is discussed. It is to be discussed whether it can easily be transposed to Europe. It will have to be validated in the European context. These are some more drugs or substances, the names of which you will know. These could be also potentially useful. You see Huantu, cannabis, curcuma, and ginger. That is ginger, obviously. So these substances could do have an impact, and we know them a little bit. Gastroenterology describes various disturbances. They are not correlated structurally among themselves, and you can see it in primitive societies. When people had a diarrhea, it was because of toxicity. Today, nowadays, we rather have failures in function. So it takes the practitioner's experience to distinguish between these two, and they can refer the patient for a surgery without any reason. So it is important to understand that you have to know how to communicate with the patient. That plays an essential role, and I think there is plenty of room for alternative treatment, acupuncture in particular. It is true that it is very difficult to validate and compare. Here you can see partial depiction of the results of acupuncture as adjuvant treatment, we have to realize or whether we understand what's the standard treatment. The symptoms are very divergent. So again, there is not a single standardized conventional treatment. If you are constipated, you don't use the same means for treatment as for diarrhea, and so on. So it is very variable, so the assessment is very difficult. What seems obvious is that what worked the best was acupuncture as compared with placebo. The outcomes were the most convincing, and you can't underestimate it. They are positive. But the quality of the studies, the validity, is a kind of an issue. What's essential in abdominal diseases are tumors of all types, which, besides its specific symptomatology and symptomatic course, are accompanied by very unpleasant problems of all kinds: insomnia, loss of appetite. This makes really the patient's life unpleasant. So meta-analysis of pains in tumor, in cancerous diseases. Again, for all the meta-analyses which I've been showing and which I will show, the same thing is true. Namely, they are difficult to compare because they use different treatment: acupuncture in combination with Chinese medicine. So it is extremely difficult to compare. Actually, what seems to fare the best is the acupuncture in combination with the traditional Chinese medicine, that is with herbs. And here the success rate dwells in the reduction of pain the most. All in all, there are 111 studies that were included in the meta-analysis, and the complex Chinese medicine plus acupuncture was assessed the best. I must say that when it comes to pain and other unpleasant symptoms, the pain is also difficult to measure, but there are systems which differ among themselves, and it is difficult to say which of them is the most relevant. So, yes, but there are some precautions to be taken. Besides the pain, people are often depressed, they don't sleep, they lose their appetite, and they also feel anxiety. So again, this is a Chinese meta-analysis, and you can see many results. These studies are extremely vast and sweeping. So I took insomnia, and the quality of the sleep, and you can see that the differences are variable. In conclusion, we can say that the treatment group works the best for depression. It also works for the quality of life, and the assessment of the quality of life is once again very unclear. But this treatment doesn't work against insomnia, so depression and quality of life, but not insomnia. As to the combination, because the effect of the symptoms are multiple, and there is a certain definition. So the sum of the side effects of the treatment, the impact for them, it worked well. This was a Danish study. It is the acupuncture for pain in chronic pancreatitis. Chronic pancreatitis is, among others, characterized with pain. So this is an understandable study. And here we compare acupuncture and the sham acupuncture. And the relief from pain was significant, but only time limited. And for chronic pancreatitis, it can be useful, though. But again, the treatment procedures themselves vary vastly. The pancreatic carcinoma is a sheer disaster. In Czechia, every year, 2,900 people fall ill, and only 400 out of that number survive. So the maximum of survival is 10%. And in my rich experience, I only know one person who was really treated. There's just one single person whom I know to have cured from the pancreatic tumor. So I don't expect a major breakthrough in the nearest future. There are studies which have been focusing on that. Their goals are variable. It is the growth of the tumor, metastasis, or side effects, cachexia, and again, the studies are very variable in the goals, so there is not a possibility for a complex assessment. What is important, though, is to focus on microbiome, because it is this which is extremely interesting area. Undoubtedly, it is very different for various diseases, and we're not always able to determine to what extent this is the cause and to what extent this is an impact. However, empirically, we've been intervening, and the probiotics show positive results, although it is variable, but we cannot really say to what extent this is a physical or a psychical effect. But it is interesting to go ahead with it. Microbiome consists of a number of bacteria. There are multiple bacteria, as the quantity of bacteria is multiple as opposed to the cells in the human body. And again, this is just for one disease, and the validity as the disease develops is questionable. But the interventions in the microbiome may have just a placebo effect, but it is encouraging. This is a study which is very good. I thought originally that it was the Chinese guaram, but I was told that there are many herbs in that. And here it is administered as an adjuvant treatment of hepatitis. Why not? I was surprised because this is a very complex study, but it was successful in all parameters. This is really very precious as a result, be it in the field of ultrasound, improvement of fibrosis, improvement of the laboratory parameters, and the effect is really important, significant. This is a study from a different cup of tea. This is a Chinese study which focuses the drug-induced liver damage. This is something which is quite frequent. And so it is in China, and you can see that where the damage was the most frequent was there where the traditional Chinese medicine, and it was hepatocellular damage. Most of the patients had a pre-existing liver condition, so these were not naive patients without any previous disease. But you have to take that into account. The traditional Chinese medicine, followed by tuberstatics, was the most frequent cause of the damage induced by drugs. What is particularly important is that there were only 2 patients who were transplanted, so the impact was not fatal. I would like now to conclude my paper by saying that I consider the Chinese medicine a potential approach, and I certainly would not object to its correct lege artis application for practically every diseases. Obviously, we have to be aware of the side effects, the possibility of liver damage, and there are 2 important things. The method should be validated for our cultural environment, and second, I think that alternative methods as such should be a part of the medical education at the faculties of medicine. I think that this is really fundamental, and it is a huge mistake if this is not done. Thank you for your attention.
Professor Špičák, we thank you for your expertise, for sharing your perspective with us today. Thank you.